Again, turning to other news, President Obama is just 3 hours away from a much-anticipated speech on the health care debate. He'll be addressing a joint session of Congress members who are struggling to reach consensus on some of the toughest issues in the debate, including government-run insurance. Public opinion on the issue doesn't appear to be going the president's way. In July, an Associated Press poll found 42% of Americans disapproved of his handling of the health care debate. That number now up to 52%. Eyewitness News reporter Jeff Pegues is in Washington, D.C. with more. Jeff?
And Sade, according to those numbers that you just mentioned, the president is losing support at a time when he needs the public behind his version of health care reform. And that's why this speech tonight is so important for his administration. We're told that he will try to clear up any confusion about his version of health care after losing ground over the summer. With Congress back in session, it is all about health care reform and the president's speech. This is a critical juncture for President Obama and his plan for health care reform. New York Senator Chuck Schumer says the goal is clear.
Well, this is a big one for him. He has to persuade the American people of the importance of doing this.
The president is vowing to do just that. In an interview on Good Morning America, he gave a preview of his address.
They will have a lot of clarity about what I think is the best way to move forward.
The reform plan so far has been stuck in neutral, bogged down by town hall-style meetings that exposed how controversial health care reform is and how divided Democrats and Republicans are over proposed legislation. But a return to Washington has some lawmakers talking compromise. Democratic Senator Max Baucus of Montana is floating a plan that would cost $900 billion over 10 years, guarantee coverage for nearly all Americans, impose fees on insurers and drug companies. But that proposal might not make a difference if the president's speech fails to convince the public. Long Island Congressman Peter King says Mr. Obama lost ground over the summer.
The president lost control of this debate 6 to 8 weeks ago, and I don't know what kind of a speech he can make tonight to get it back unless he modifies his plan.
And in that speech tonight, the president is expected to offer specifics, but he's not, we're told, expected to draw a line in the sand over the so-called public option, and that's something that might appeal to Republicans, but it could mean trouble with liberal Democrats within the president's own party. We're live in Washington. Jeff Pegues, Channel 7. Eyewitness News.
President Obama is set to address both houses of Congress, pushing his vision for health care reform. Now, the speech couldn't come at a more pivotal time. A new Associated Press poll shows 52% of Americans disapprove of his handling of health care, and that is up 9 points from July. His overall job performance has also slipped. 49% disapprove, where in July it was 42%. CBS 2 political reporter Marcia Kramer has a preview now of tonight's speech.
Facing plunging public support and a summer of harsh criticism in town hall meetings from coast to coast, President Obama will try to revive plans for a major health care overhaul tonight. The president is expected to explain why he thinks a public insurance plan is the best way to get greater competition into the system.
There's no choice, there's no competition. Those are exactly the things that we have to see in health care reform.
But there are some who think the president will run into personal and political trouble if he takes a hard line on the government plan, also called the public option.
I believe that if he goes ahead with his public option plan, you're going to see large Democratic losses at the polls this November as well as next November.
Senator Charles Schumer says it's good to offer a public option.
You can stay with your private, no one's going to force you out, or go to the public. You have the choice, and to have the competition between the two makes both of them better and gives the consumer a better leg up. So it's the same as having public colleges and private colleges.
A bipartisan group of 6 senators led by Finance Chair Max Baucus is trying to draft a new version of health reform, one that does not include the public option. That proposal would require health insurers to chip in $6 billion a year to help pay for the program and demand that by the year 2013, everyone in the country sign up for some form of health insurance. If they don't, they would be fined $950 for individuals and $3,800 for families above the poverty line.
As far as taxing people who don't have coverage, to me that is too too big a role for the government to play. You can't have the government running our lives, telling us what we have to do.
The president is also expected to deal with the sticky issue of how to get health coverage for the 50 million Americans who now lack it. I'm Marcia Kramer, CBS 2 News.
And Bill, clearly he extended an olive branch to his critics. He's not digging in on the public option. He tried to clear the air on some of the other controversial issues. Still, this is a 47-minute speech, and if you look at some of the reaction to it here on Capitol Hill, that could signal that compromise may not be in the cards anytime soon. It was the president's most impassioned defense of health care reform to date. With slipping poll numbers, it might have been necessary to rebuild lost ground.
I am not the first president to take up this cause, but I am determined to be the last.
In his second address to a joint session of Congress, Mr. Obama delivered a speech that outlined his ideas for health care reform. He vowed to build on what works and fix what doesn't. He says you won't be required to change coverage or doctors, adding that reform will provide more stability, more security. For those without health insurance, he promised quality, affordable choices, a health insurance exchange that will lower costs. And he says individuals should be required to carry basic health insurance. How all of that happens is the big question.
I think if enough people watched, this will have a dramatic effect. If people didn't watch and everyone was watching the Yankee game, then it won't.
He did seem to back away from the public option, and whether that's real or whether that's a negotiating ploy, we'll see.
The president also took aim at some of his critics about those so-called death panels.
It is a lie, plain and simple.
He also says health care reform won't cover illegal immigrants. That prompted someone in the House chamber to yell, "You lie." Further evidence this speech is but another step along what has already been a long road to possible health care reform. And that outburst came from Republican Congressman from South Carolina, Joe Wilson, who just a few minutes ago said that he apologized, calling his comments inappropriate and regrettable. He says that he apologized to the White House. He ended up speaking with the president's chief of staff, Rahm Emanuel. We're live in Washington. Jeff Pegues, Channel 7 Eyewitness News.